Welcome to the discussion on the physiological effects of proximal compress. In the last class, we had seen that there will be constriction of the distal part of the blood vessel when the cold application is done on the proximal part. This was the observation by Vinteni's experiment, where the ice was given to the cubital area and the contraction in the digital blood vessels was observed. So, whenever we say about the vasoconstriction, that is constriction of the blood vessels, we have to remember about the structure of the artery, vein and capillary. Now, when we say that the structure of the artery, vein and capillary, you can see this slide here. There are three layers in artery and vein. They are considered as tunica adventitia, tunica media and tunica intima. So, in capillary we have two layers made up of endothelial cell and pericyte. So, this is the structure of the artery, vein and capillary. If we compare the anatomy or the structure of blood vessel, here artery and vein, we can see that in the tunica media, the artery has more smooth muscle, okay, the wider, we can just say thicker smooth muscle with more collagen fibers. But in vein, comparatively it is less. But both of these are capable of contracting and decreasing the lumen of the vessel through the collagen fibers. So, compared to vein, the elasticity is more in artery because of thick muscular layer. When we say about the vasoconstriction, we can just compare the lumen of the artery. You can just see the normal artery with normal lumen size, and when vasoconstriction occurs, there will be contraction of the smooth muscles, reducing the lumen size, and you can just compare with the relaxation of the smooth muscle and leading to vasodilatation. But here we are more concentrating on vasoconstriction. Vasodilatation effect is not there. This vasoconstriction effect is seen to reduce the blood flow to the distal part from the site where the vasoconstriction had occurred. From then onwards, there will be decreased blood flow. So, we can easily understand by seeing the size of the lumen, and this is applicable for veins and arteries. So, the smooth muscles in the blood vessel wall, it gets tightened. So, that tightening of the smooth muscle results in constriction. Whenever we say the constriction had occurred, many times it helps the body to minimize the heat loss, decrease the blood flow to the skin, and since the skin is, we can just say larger organ in the body, we can just say the constriction at the surface, it helps to preserve the normal internal core temperature. And when there is constriction in the skin surface, there will be shunting of the blood into the internal viscera, improving the activity of the internal viscera. So, vasoconstriction is physiologically more helpful for improving the function of the internal organs, and also to maintain the core temperature, and also to have less blood flow to the skin whenever it is necessary. So, that is the advantage of having smooth muscle contraction in the blood vessels. Now, in capillaries, it is the constriction of the pericyte which decreases the size of the lumen. So, whenever there is decrease in the size of the lumen in capillary, the movement of the blood from the arterial end of the capillary will be restricted, and there will be less congestion in the venous part of the capillary. So, we can just say that vasoconstriction has many beneficial effects. So, that is what we are observing in the application to the proximal part. There is a difference between constriction and vasodilatation. This is being vasoconstriction and vasodilatation. This is being depicted in the figure, and you can just see the application given to the proximal part in the form of cold compress. Actually, we prefer cold temperature for prolonged duration in the proximal compress. So, usually we give proximal cold prolonged compress to have more vasoconstriction effect. So, application is given to the proximal part and there will be constriction in the distal part. Many times we feel that the constriction, it may hurt the body, but it is not so. It can also help the body by preparing the body for next application. Before giving hot application, we want to give cold application so that there will be vasoconstriction, and after hot application there will be sudden vasodilatation. Because of hot temperature there will be vasodilatory effect, and there will be intensive vasodilatation because of preparation of the body through cold application. So, vasoconstriction in cold, it prepares the body for the hot application. But in older people, many times the response of the blood vessel may not be quicker, so we need to assist them by giving them neutral temperature. So, in older people usually we go for neutral proximal compress. Even in neutral we have a prolonged neutral compress because prolonged duration is known for having sedative effect, and that is being added by the neutral temperature. So, there will be increased vasoconstriction in the prolonged neutral proximal compress. But too much of vasoconstriction can raise the blood pressure and it can put someone with hyperthermia at the risk of heat stroke. So, whenever we say about the beneficial effects of vasoconstriction, we should know when we have to stop the vasoconstriction so that we can plan better for the temperature and duration of the proximal compress according to the ability, age and condition of the skin condition as well as pathological condition of the person. So, we will just continue with the discussion in the next class. So, please stay back and we will just go for the indications and contraindications of proximal compress in detail. Thank you.